Tuberculosis, also known as TB. Everything you need to know. TB is an airborne disease caused by inhaling bacteria. It mainly affects the lungs. Tuberculosis is aimed to be eradicated by 2035. The mainly affected part of the body is the lungs, but tuberculosis also affects other body parts. Symptoms include coughing, bloody coughs, chest pain, fever, night sweats, chills, and fatigue. Tuberculosis can be prevented by taking the vaccine known as BCG. There has been over 1.7 million deaths due to TB and 16 million active infections. Immune responses to Mycobacterium TB are only partially effective. They drive the bacteria into a latent state, but very rarely eliminate them. Tuberculosis is a treatable and sometimes curable bacterial disease, but you can prevent getting it in the first place with the BCG vaccine. This helps to prevent a person from getting TB, but this vaccine does not always work. Though it protects against the bacterial disease, you can still contract it, and as it does not protect them from every strand of TB. Typically, these are the strands which are more difficult to treat. Today, we have a few different tests for TB. Every day, there are 24,000 new cases, but 4 out of every 10 people don't get tested. This means they don't know they have the disease, and they infect at least 10 new people every year. The World Health Organization plans on completely eradicating TB by the year 2035. This means that more accurate testing will need to be developed, along with a more effective and cheaper vaccine. Today, there are 2 main tests used to diagnose TB. The most common of the 2 is the skin test. For this test, a PPD tuberculin shot is injected just under the skin. Within 48 to 72 hours, one of 2 things will happen. You will have a red lump form on your arm, or there will be nothing. If your skin forms the red puffy spot, then you tested positive for tuberculosis. But if you didn't have a lump, you're okay. Although this test is very common, it isn't always accurate. If you are a child, elderly, have HIV, or have recently received the TB vaccine, then you may have a false reading. If you tested positive, then you will often receive a blood test just to make sure. For this test, they basically just examine your blood to see if it has any TB bacterium in it. If found, then you have TB. This test is becoming more popular because it is more accurate, but both are commonly used by physicians. Treatment for TB infections takes longer than most bacterial infections. When the patient is treated with antibiotics, it can take anywhere from 6 to 9 months for the treatment to work. However, how long it will take to work depends on the person and the strand of TB, as some strands are resistant to certain antibiotics. To treat latent strands, you can take 1 or more medication, which will take around 4 months. But if you have active TB, you have to use a complex mixture of medications to find the best possible treatment. In order to eradicate TB, we need to design more accurate testing and provide this more accurate testing to those who cannot typically get it. It's also important to design a TB vaccine that is better at preventing the disease and to administer said vaccine to those in countries most affected by TB. We also need to find a cheaper, quicker, and more effective treatment than the one we currently have. In order to get rid of TB, the number of people with HIV needs to decrease, as that is the #1 reason why someone will contract TB. In order to accomplish these tasks, it's estimated that we need $2 billion annually, but we currently only have 1/3 of the funding needed. There are 3 main determinants that increase the spread of TB. The first one is poverty. Poverty causes crowded, badly ventilated areas. People close together means bacteria is transmitted more easily. Poverty also causes malnutrition, terrible sanitation, and a lack of health information. Our second determinant is malnutrition, which is often caused by poverty. Malnutrition causes a weaker body and a weaker immune system. This means that it is easier to become infected with TB because your weak immune system can't fight off the bacteria. The third biggest determinant is a lack of health information and knowledge. This lack of health information leads to risk factors including HIV, smoking, and alcohol abuse. Each of these makes it harder for your body to fight infection. This increases the chances of getting TB or other communicable and non-communicable diseases. African regions are most affected with TB. From 2004 to 2011, the percentage of patients with tuberculosis in the African regions has gone up about 70%. The global percentage of tuberculosis went up about 40%, and the regions outside of Africa have gone up about 30%. However, this graph only shows the percentage of people who have HIV. It doesn't count for thousands of other people who have tuberculosis without HIV. Those with HIV are more susceptible to catching tuberculosis because this viral disease destroys one's immune system and the ability to fight off diseases, allowing the TB bacteria to easily infect your body. Tuberculosis can be found almost anywhere in the world. However, it is more common in some places and much more rare in others. South Africa is the most affected with the disease. Some of the countries that have a higher percentage of TB are Afghanistan, Bangladesh, Brazil, Cambodia, China, the Congos, Ethiopia, India, Indonesia, Kenya, Zimbabwe, Mozambique, Myanmar, Nigeria, Pakistan, the Philippines, Russia, South Africa, Tanzania, Thailand, Uganda, and Vietnam. When people are diagnosed with having TB, they aren't really able to do hard labor because they feel weak and they often have extreme, unexplained weight loss. Along with all this, they are exhausted because their body is also fighting off an infection. And without any treatment, the victim is almost guaranteed death. Successful interventions approved by the FDA that are used to control tuberculosis are antibiotics. These antibiotics contain isoniazid, rifampin, ethambutol, and pyrazinamide. These drugs are taken all at once to cure TB, as shown in the picture, because if they are taken individually, then the TB may develop resistance to that drug and will be considered useless. If the TB is drug resistant, then monitoring the patient will be needed. Efforts the World Health Organization do to assist patients in countries affected by TB are creating World TB Day on March 24th, where we build public awareness about the disease in hopes to raise efforts to eliminate tuberculosis. The World Health Organization also plans on making a committee of people around the world to create plans on how to eradicate tuberculosis. The World Health Organization plans on having 95% of tuberculosis eradicated between 2015 to 2035. WHO raises $2.3 billion a year to help fund the TB care around the world. They help pay for the resources to help cure patients. The progress of treating tuberculosis has come a long way. We have helped to treat many people with tuberculosis, but we need to keep providing treatment to people who need it. And meeting the 2035 eradication of tuberculosis would be amazing and an event we cannot miss. We are now at the end of our presentation. Thank you for listening.